Welcome to Weird Works. I'm Dr. Kristy, your host. This podcast was designed to create a space where conversations about alternative healthcare topics can occur in an open platform without judgment. We will bring the facts that support sometimes controversial subjects in an attempt to break down barriers towards accessing true healthcare. All too often, alternative care is sought after as a last resort rather than a first option. This podcast will provide the evidence that you need in order to make informed decisions about your health, to empower you with the facts that you need to take your health into your own hands, and to encourage you that there is hope, your body heals. Join us to hear from experts of all things weird, as well as the testimonies of people with stories of radical healing who were once told that their condition was a death sentence, maybe that they would just have to live with it, or that drugs and surgeries were the only answer. We look forward to sharing stories of encouragement with you. Please leave your questions in the comments so that we can engage with you. And don't feel shy or hesitate to let us know what alternative healthcare topics you would like to hear more of on the Weird Works podcast. In good health naturally, I'm Dr. Kristy. Hello, everybody. I am here with the one and only April Caldwell today. So April has a super fun story. And I'm going to have her first tell a little bit about how we got to know each other and how we got connected. But her story basically takes her from being a patient all the way up to our practice manager of recent. So April, how did we get to know each other? How did we first meet?
So I was working with Stephanie Lincoln. She's a health coach, and we were working through some things, and she referred me to come and see you.
As a patient?
As a patient,
okay.
Yes. And, by this time I had, spent 20 years in pain, being told I had tendonitis, so just always hurting. Things have kind of gotten worse with my health and how I felt and my pain. And then I'm a disabled vet, and the VA had told me right before I came to you that I had fibromyalgia and basically to go do Tai Chi and good luck. Because there was nothing they could do. Yes.
Okay, so we know what we all think about that story because unfortunately a lot of people have been told the same thing, like, too bad, so sad, we have nothing more to offer you, or just go figure it out on your own kind of a thing, right?
Yeah.
So how did you feel about that?
I don't think I can use the language of how I really feel. I was frustrated. I was upset. I was disheartened, disillusioned, and just mad.
Yeah. And had you tried other things, or just being a disabled vet, like you kind of had to go to the VA?
I kind of had to go to the VA. I didn't have a whole lot of options. I had tried acupuncture on and off. Okay. I had tried different, PT kind of things to put on my arm to help with the pain. Mm-hmm. Definitely like over-the-counter medication, prescription, painkillers. I mean, I feel like I had tried everything that I knew to try and everything that they would allow me to try.
Yeah, pretty much all the traditional routes you had already gone through.
Yeah.
Okay. So then you came in. So what happened when Stephanie Lincoln referred you? Like, what were the steps?
Well, I trusted Stephanie, so I just called her and I made an appointment.
Okay.
And so I came in, I saw you. And I'm a numbers girl. I like, my data. I like evidence. And this was a little woo for me. I had done acupuncture and it's had great results. But I trusted Stephanie. I met you. I trusted you. Came back from my reported findings. You started me on program. Mm-hmm. And I think then I had to go to a convention almost immediately out in Las Vegas and sit in like auditorium seating. And I can remember sitting there for like 8 hours, and it hit me that I wasn't fidgeting in my seat. I wasn't trying to get comfortable. I wasn't trying to get out of pain. I'm like, oh, okay. And so as I then walked from my hotel back from the auditorium back to my hotel, which was, also an unusual thing, I saw this metal railing that I had to like walk around to get to my hotel. And I was like, I bet I could jump that. And so late 30s, this is a thought I've never had in my entire life. But I felt so good. Yeah. I wasn't hurting. I had energy. And I was just excited to feel this way.
Yeah. So what were you doing? Were you a nutrition patient, a chiropractic patient, or were you doing both at that point?
I'm trying to remember. I know I was definitely a nutrition patient,
Mm-hmm.
and then we've done chiro together,
Yeah.
on and off. So I might have just been a nutrition patient at that point. Yeah.
And then how quickly did you start to feel that way?
Oh my, I'm laughing because it was almost immediately.
Yeah.
Yeah. I mean, it was
Crazy.
Yeah, I don't know if I told you I was going to tell this. So I had a really good week, and then my second week, I felt like crap, right? And I came into you and I'm like, Dr. Kristy, like, what happened? I want to go back to how I felt.
Yeah.
And you let me know my body was detoxing, right? It was getting rid of all of this stuff. And, and I did. I got through it. But I sat in your office, I think, that day and I cried.
Yeah.
I was so angry that I wasted all of this time living with this.
Yeah.
Thinking, okay, this is how I have to spend the rest of my life.
Right.
And then when I had that good feeling, and then that feeling temporarily went away, look, I can't do this. Now that I know the other side, I can't go back.
Right, you got a glimpse of what could be, and then it feels like it's like you lost it a second time,
right?
Right?
Ha!
Yeah. And that's important to understand too, because a lot of patients, like, you get a glimpse of what could be, like we just said, which I always love, because I love when people get confirmation that there's hope and like there's a different way, and you don't have to live with it regardless of what you've been told for the last 20 years. But at the same time, the body is a process, and so the body has to get through it, right? And so that's a big part of it, is managing those expectations for somebody through the entire healing process. So obviously you stuck with it.
I did.
You're sitting here with me
Yes.
today. Okay, so you go from 20 years of pain with the VA, being told, too bad, so sad, there's nothing more we can do, to wanting to hurdle over chairs in a short while. So that's pretty cool. So then how did you and I get involved further at that point?
So I am a money coach working with women, and I have an organization, a group called Trailblazers, which I invited you to speak at.
Yeah.
And that was on a smaller stage, and then I invited you to participate in the mastermind because I saw your business savvy and what you were doing and how you were helping people, and I really just wanted a way to pick your brain.
Free advice.
Yes. Budget conscious. And then when I went and did bigger events, like with the Women's Expo with over 200 women, I wanted you to speak as well. So that's kind of how we started getting more involved.
Right. And then we became friends.
Yes, we did.
And that's the cool part, is like with me and April, she went from patient, but we had so much in common, being like female business owners, entrepreneurs, and then found ourselves like similar circles that we quick became friends. And we're probably like some of the nerdiest people on the planet. So we started going on mastermind retreats where we go away with a bunch of girlfriends so that we can get work done away from our family and other responsibilities. But we've been friends ever since. And so now take us up to this point. So how did you hear about the practice manager position? Did I approach you about it?
Well, you didn't. But you know what? I did forget in my journey to mention.
What?
Was how you saved me from surgery twice.
Oh yeah.
So I had this Gertrude growing on my side, like it was this lipoma that just kept getting bigger and bigger.
Yeah.
And I had her for so long, so I named her
Gertie. We called her Gertie in the office.
And the VA was going to do surgery to go in and remove it and all of that. And you gave me this little bottle that I put on it for a couple of days, and it was gone. Like it shrunk back down, the pain was gone. It wasn't, every time I moved my arm, I wasn't hitting it.
Right.
And then I had an L3, L4 injury. So I wish it was something heroic, but I was cleaning out my fridge.
I remember.
And I twisted and turned the wrong way and hit the ground. And I went to go see a VA chiropractor who did all this stuff. And I left in worse shape than before. And so I call you, and I'm laying in bed. I can't put on my own shoes. I can't get out of bed by myself. And I call you, and you came over, and you muscle tested me. I was in bed, yes. And you're like, it's either an L3 or an L4 injury. Something's going on there. And I ended up going and getting an MRI. I think it was and they told me it was an L3 and L4 injury.
Gotta love muscle testing.
Right. And the VA wanted to operate again, and I refused. And through nutrition and chiro, you got me walking, you got me back in heels,
I'm wearing these for April today.
And back to normal.
That's awesome.
Yes. So then, so I continued, of course, as a patient and as your friend, and really saw your mission, what you were trying to do, and how you were trying to help people. And I saw you stuck because, like, on the mastermind end, I got like an inside look, and you couldn't grow and you couldn't, share your message more because you're handling staff and inventory and all the things.
Yeah, so you got to hear all the frustrations of, like, we were having rapid growth, but I was doing too many things, trying to be the main practitioner, the human resource department, the accounting department, managing the facilities, all this kind of stuff. And so us hiring a practice manager was way overdue by the time this all came about. But I was like, who in the world am I going to trust with all of this stuff? And that's going to be able to work with my specific personality type. And I just did not believe that I was going to find anybody that would be able to carry my brand and my message and represent me and my mission and everything well. So yeah, you got to hear all the agony of the growth that we've had in Jacksonville, right?
Yeah, yes, absolutely. And knew you could do more and wanted to do more. And we've been telling you for years to get somebody.
Yeah, they did.
And so I was coming up with a change in my life, and I told you I wanted a job. And you kind of like, haha, okay. And I'm like, wait, no, I want the job.
I kind of brushed it off, like, don't tease me. That was my thought. Like, this would be too good to be true, but why in the world would she want to come and work for me? So she's had her own company and brand and has a great following. Like, that's nice, April. I would love it. But yeah, right.
And so I approached her again and kind of got the same response, right? And then when we went away on our mastermind retreat, I basically told you were hiring me and that I was starting on Wednesday.
And what day did you start?
Monday.
She just showed up. I'm like, I think she's serious.
And the rest is history.
That's it. And here we are today. But tell me a little bit, like, why did you want to team up with me? I know you talked about, like, your own story, so obviously you were a believer in the clinical side of things,
Absolutely. I was a believer. I'm a walking, testimony. I believe in what you do. And then I knew on the operational side that I could help you expand. I could help you share your message, get on a bigger stage, and do the things that you wanted to do. And you have an important message. What you do changes people's lives. And I wanted to help you be able to do that. So I could take over HR and legal and accounting and inventory and staffing and all the things.
Yeah.
So that you could focus on what you were really put here to do.
Yeah. And it's incredible. That's why we're sitting here in this room, bringing a message across the podcast channels now, bringing other people in so that we can introduce the office and our clients and our followings to other people. But it takes a weight off of me because I need to be a walking, breathing, living testimonial of my own work, and it's no good for me or my brand or for any of you who are, dependent on us as patients and for education and information if all the while I'm doing this and it's at my own, at the suffering of my own health to do it. And so, I had to kind of step up and be like, what would I tell patients? Like, oftentimes we're asking them to make lifestyle modifications and saying, like, maybe you need to rethink your new normal, so that you can fully heal and recover. So all the while I'm like, maybe I should take my own advice. So yeah, it's like I say all the time, like, we're so blessed to have April with us because we do believe in our message to take this beyond, just Jacksonville, Florida. And I'm called really to get out there and be the name and the face of the practice and have an awesome trained up team of associates and staff here to welcome people as they flood our doors. And so I'm finally able to be liberated to get out there and do some of these fun, more creative things and get on the lecture panel and bring you the advice and expertise of other services. And then April, it couldn't be a better fit because, you know, I tell her every day, like, isn't it cool that you're my friend? So I obviously trust you and can speak openly and honest with you. You know, you have the ability to understand. She's had her own business, so she knows the workings of a business. She brings in her expertise, financial background with money coaching, and she built her own brand completely on social media. So she understands the marketing aspect of it. So she works in so many different functions for me. And we're still friends at the end of the day.
Yes, we are.
I think people are surprised about that. We still hang out even outside of our treacherous hours that we keep here at Health by Design. So I'm just excited to introduce everyone to April. She works behind the scenes, and I wanted you to know what she's doing so hard for all of us so that we can experience Health by Design in its entirety. So thanks and welcome.
Thank you. I appreciate it. And I will say, one thing I do love is even though you're growing and you have a flood of people coming in, it's still like family. I've referred so many people here when I was a patient that I come in every day and I see 3-4 people that I know, and it's hugs and it's, you know, just catching up. So it's still like a family.
Right. Well, that's important to us. We believe in growth, and we believe in reaching as many people as possible and providing, you know, excellent care to everyone. But we would never want to sacrifice volume for the quality of care. And so it's important to us that we keep that family style and that living room style practice where people can intermingle and know each other and feel confident referring friends and family and everything like that. So that's incredible feedback. We hope you guys all feel the same way. I hope you can help me welcome April aboard. If you see her, you'll now know what she's doing and what her title is as practice manager here. And just keep looking forward to Health by Design's growth and expansion. Lots of exciting, fun things on the horizon for us here. Thanks.
Bye.
Thanks for joining us in Good Health Naturally, Dr. Kristy.